Hi, my name is Ezgi.
I'm Georgina.
And we're pelvic floor physical therapists here at Spear, and we're going to talk about when you might be needing some pelvic floor PT.
So some of the objectives of this talk is that we hope you guys understand the basic function and anatomy of the female pelvic floor, that you become aware of common dysfunctions and the systems they belong to, and then becoming familiar with pelvic floor rehab and when to seek out treatment, and then gaining tools for common at-home treatment techniques for self-management when appropriate. And then also we want you guys to feel educated and empowered.
So first we're going to talk about what the pelvic floor is and the basic anatomy. So when we're thinking about the pelvic floor, we are thinking of this sling of muscles, nerves, tissues, and ligaments that cover the floor of the pelvis. They reach all the way from your pubic bone to the tailbone. On top of these muscles is going to be our bladder, our uterus, and our colon. So the pelvic floor is a huge part of assisting our urinary tract, our digestive tract, and reproductive organs, as well as some trunk stability and mobility, since it's located on the bottom of the spine with our core muscles as well. So it ends up being in this very central and important part of the body. So within the pelvic floor itself, each of the muscles have a different function, but we can simplify and divide the pelvic floor into two parts known as a urogenital triangle, which assists in orgasms and bladder function in men and women, and the anal triangle, which is going to include the rest of the pelvic floor musculature, and also helping in bowel and sexual function. So overall, within the pelvic floor, we're looking at three really important purposes. So it's going to be supporting and cushioning within the pelvis and the lower abdomen. It's going to be controlling signals, of elimination urges to the bowel and the bladder to coordinate appropriate opening, and then closing of the urethra and the anal canals when needed. And the third one, it's a mechanism of sexual function. So it's going to be contracting the muscles around our genitalia to respond to arousal as well.
Okay, and this is your pelvic floor. So we have the uterus, the bladder, and the rectum. And so these three organs, below them is where your muscles are. And so the deepest layer, that's where that sling is that Ezgi was talking about. And then the layer 2 is underneath here, and then layer 1 is on the outside. So everything that she just talked about, that's what we have here.
So obviously, these include very complicated and vital functions, which is why so many of these thicker muscles are involved in making all of these functions happen. However, because they're so close in proximity, that can also cause some issues and can be a disadvantage, because one disorder in a part of the pelvic floor can easily affect another. And any of these systems that we've been talking about can be impacted. But we can also see problems both above the pelvis that kind of travel along up to your TMJ basically, and or above the pelvis and below the pelvis as well, with different musculoskeletal issues because of this. In terms of this dysfunction that we're talking about, how often it can happen is around 53% of adult women at some point in their life suffer from pelvic floor dysfunction. And when you're looking at women over 40 years old, this number goes up to 65%. And this is all while considering that these diagnoses are frequently undiagnosed. So in order for you to be able to tell when you have dysfunction and you're not a part of the stats that are underreported or undiagnosed, you can just ask yourself some questions about each of these functions. When we're considering the bowel and bladder, they're going to be focusing on urges, that sensation to go, and as well as controlling the opening. So if there's any dysfunction here, someone can have trouble storing what needs to be stored or emptying what our bodies are needing to get rid of. Depending on where on the spectrum you fall, you might be having a full uncomfortable feeling in the lower abdomen. Emptying either takes a lot of time and effort, or you're going to the bathroom an excessive amount, which is starting to impact your daily functioning. And over time, our response to how we handle these issues with our own ways, whether that's trying to avoid irritation through going to the bathroom very often, or you're straining to empty, whatever we think might be helpful, creates these patterns and habits within our brain, our nervous systems, our organs that only contribute to the cycle of discomfort, essentially. And to have a more specific idea of these issues, some questions that you can answer yourself almost as a self-screen to see if you might need some help. Starting with the bladder would be if you're experiencing some loss of urine with coughing, sneezing, laughing, lifting, so any pressure that's not being handled correctly within the abdomen. A frequency of your urination, so are you going to the bathroom really often, more than once every 2 hours, or a bunch of times within an hour, or an urgency to urinate with very little warning, so whenever you have to go, you really need to go. Any loss of urine because of that urge, or difficulty initiating or emptying fully. In terms of bowel movements, you can ask yourself if you're being constipated pretty often, if you're having bowel frequency, so you're going more than 3 times a day. Similar to the bladder issues, if you're having any trouble initiating, emptying fully, or if you're having that sense of urgency and you really need to go whenever you need to go. And then you can also, with bowel movements, you can look at the consistency. So you want to make sure that it's not too hard, it's not too watery, and we always want a nice medium. In terms of sexual function, there's a whole range of problems that can be experienced. But the first question you can ask yourself is if you have pain with sex. So this can be with on my in a part of the pelvic floor can easily affect another. And then you can also, with bowel movements, you can look at the consistency. So you want to make sure that it's not too hard, it's not too watery, and we always want a nice medium. In terms of sexual function, there's a whole range of problems that can be experienced. But the first question you can ask yourself is if you have pain with sex. So this can be with superficial penetration, deeper penetration, external stimulation, or you might be having some pain or discomfort upon arousal with orgasms, or you might have trouble having an orgasm at all, which can also be a part of that pelvic floor dysfunction. And as another general category, pain tends to be huge within pelvic floor dysfunction. So especially with any of these components that we mentioned, it can start a cycle that's causing more pain just because our response to any discomfort is tensing up a little bit, and that chronic tension and shortening can result in pain, regardless of what diagnoses you might have had initially as well. And in addition to pain with sex, you can also take note if you have any pain with emptying your bowel or bladder or any abdominal discomfort, that those issues might bring as well. Here we're also talking about painful periods with severe cramps, musculoskeletal pains that might come up in the low back, your thighs, your sits bones, and other joints, to just name a few. On top of muscles that surround the areas, other tissues like your nerves might be getting irritated just because of that shortening of the muscles that they're passing through, as well as blood vessels that might get congested just because of similar reasons within this physical cycle that's happening.
Okay, so some signs that you may need pelvic floor physical therapy, how, like Ezgi said, pain during sex, if you have pain with tampons or penetration, if you have any bladder leaking, if you're pregnant, if you're having any urinary urgency and frequency, also same thing for fecal urgency and frequency, if you're having a lot of constipation, if you're postpartum, and if you've had any like abdominal surgery. So that includes C-sections, endometriosis, hernia repairs, things like that. Okay, so what to expect at your first visit. At your first visit, your pelvic floor PT will be asking you a lot of questions, and you guys will be talking a lot. So come prepared to talk. There's information that we need to know specifically about why you're here, and so that we can provide you with enough education and good education to help you understand your diagnosis and then provide you with a treatment plan. So the first thing is the history. So your PT will be asking you specific questions about how your pain started and why you are coming to PT. And be prepared to come with answers to these questions of like time frames, when it started, any surgery dates that may be significant, any medications you're taking, and then any significant past medical history that would apply to your condition. And then after that, then we'll provide you with some education regarding any, like your pelvic floor anatomy, like how we educated you here, and then all of the muscles, how they work together, what's normal, what's not normal, what each muscle does, and then just going over like norms, like how many times a day you should be going to the bathroom, things like that. And so then depending on what you're coming in for PT, your PT will also go over maybe some lifestyle modifications that she would like you to implement, like any bladder, bowel, diet, exercise habits that you should start implementing. And then after the education part, then she'll go into an internal and external exam. So you will start the exam by laying on the treatment table with the therapist at one end. The external pelvic exam consists of looking at the tissue, so of the whole vulva, so the labia and the clitoris and just all the perineum, all the structures in around the pelvic floor. And then also looking at the whole movement of the perineum. So during a Kegel, how you bear down, just seeing what your norm is like. And then the internal pelvic exam consists of the PT is inserting one finger into the vaginal canal, and we do this because then we can feel all 3 layers of the pelvic floor. So we can go all the way to layer 3, and then we can see layer 1 and 2, and then we're able to feel all the muscles, and that helps us determine if you have any muscle tension, any trigger points, and how strong you are, because that is what is going to help us determine your treatment plan and what we need to do to help fix it for you. After your therapist diagnoses you, then you'll come up with a treatment plan together that's based on your goals that were set when you were talking in the beginning. So your therapist will be asking you, what are some of your goals for PT? What do you want to get out of this? And then based on that, we'll help you with some lifestyle modifications, exercises, ways to help you so that you can get better and not have any more pain. And then after the treatment plan, then it will most likely consist of a home program, so things that you will have to be implementing into your daily life. And consistency is key to really see changes, especially for pelvic floor. Things take time, but if you're not going to put in the time, then you're not going to get better. So it's really important that you stick to your exercises and everything that your PT is telling you. So some treatment options that your PT might do with you, this is very general. So you're not going to be doing all of this on day 1. You might not do any of it. You might do 1 or 2 things, and even throughout your whole time here, you might not do every single one of these things that I'm going to mention. But some of them are pelvic floor strengthening, core strengthening, bladder diary. So with the bladder diary, we would tell you to keep track of how many times a day you're going, when you're going, what you drank, how much you drank, if you were straining during, or if you really had to pee, if you leaked, things like that, just so that we know what your normal bladder habits are. Pelvic floor stretching, relaxation techniques, bladder retraining, bladder mobilization. So bladder mobilization would be like us putting our hands on right below the belly button on the abdomen and just seeing where if you're restricted in your bladder. Diaphragmatic breathing, visceral mobilization. So same kind of thing with the bladder. Visceral mobilization is getting all of the other organs moving and together well. And then abdominal massage. I like to do the I love you massage a lot for my patients, and it's very relaxing. Dilators. So dilators are tools that we have our patients buy and then they bring in, and that's for if they're having pain with sex. And then another one is the pelvic wand, which is a trigger point release, and that is also helpful for people who have pelvic pain or any tightness. Posture education, and then external and internal manual therapy, and then patient education.
Okay, so some things that you can do at home if you're noticing some of these patterns and symptoms. And these treatments are not one size fits all. So of course, if these symptoms are persistent, you would always want to see a healthcare provider. But these are just some good basics for you to start thinking about as you kind of take charge of what you want to do with the pain or discomfort that you're having. So the first thing is an easy one, which is just to breathe and focus on some relaxation techniques. Especially when we're considering pain and tightness, we want to focus on that down training of the pelvic floor and make sure that everything's at a good baseline. So with this, we're talking about mindful, conscious breathing. That's a little deeper than our daily pattern, so diaphragmatic breathing. When we are switching over to this, we're also promoting the relaxation of the pelvic floor, as well as the relaxation of the muscles of the body and overall tension. So the first thing you can do at home is an easy start, which is to breathe and focus on relaxing, especially when talking about tension and pain within our bodies. So we're talking about mindful and conscious breathing, which is a little deeper than our daily pattern. So we can get the pelvic floor involved in this movement as well. In order to try this, you can place one hand on your chest and one on your belly, and Georgina can show this. You want to make sure that you're getting movement from your chest, your belly, and a little bit of an expansion of the rib cage. So those are the 3 areas we want to focus on while breathing. In order to make this even more effective, as you inhale, you can take 4 seconds for a big inhale, pause for 2 seconds, and then exhale for 4. And as you're doing these motions, you should feel your chest and belly rise and kind of recoil and relax. Even just taking the time to slow things down is a very effective and easy start for pelvic relaxation training. So that's number 1. So second, kind of going along with this relaxation training, we want to make sure that you're not assuming that you're going to need to do Kegels or that they're going to help you. Just because we hear about them everywhere and how helpful they are and how a lot of us should be doing Kegels for strengthening our pelvic floor. And this is not always the case, and sometimes it can do more harm than good when performed at inappropriate times when that's not what the body is wanting or needing. Because of any issues we might have in any of these systems, as well as daily stress levels and living, maintaining ourselves in this tense position for long periods of time can cause shortening and restriction in our muscles, and this unfortunately becomes the norm for our bodies. And although this change can also technically cause weakness, we want to make sure that our tissues are at a good baseline and lengthen before we even consider strength training or any other training in order to prevent further injury. Third, another simpler one, you just want to make sure that you're emptying your bowel and bladder correctly and in the right way. So in terms of both bowel and bladder movements, we're considering your diet, your habits, your activity levels. So the first thing is going to be hydration. So for bowel movements, it helps you not get constipated and it keeps things moving. In terms of bladder, it helps calm down the effects of other fluids that might be irritants for the bladder to keep it healthy and calm. Second, when considering peeing alone, you want to make sure that you're managing how often you're consuming things like alcohol and coffee and acidic or spicy foods, especially if you are someone that's dealing with that urgency, that frequent need to go. These are some substances that you might want to consider decreasing. And you don't want to fall into just in case peeing, which we all have done at some point. So before leaving your house, when you're going on a 30-minute train ride, you don't want to be creating this pattern for your bladder where it's thinking, before we're full, we can go to the bathroom. So it starts creating this habit where the tolerance of your bladder is kind of decreasing in how much you can store your bladder. If you experience frequent nighttime peeing, that's something that is affecting your daily function, interrupting your sleep. You want to stop fluid intake 2 hours before going to bed. Whenever you're going to pee, you never want to push or perform what we call power peeing. You just need to sit, breathe, and let it all come out. That's the natural way to do it. And again, you don't want to be creating these different and new patterns. With bowel movements, diet again is huge. You want to make sure that you're eating a lot of fruits and vegetables for that good fiber and magnesium. On top of a good diet, you also want to be exercising regularly, again, to keep things moving. So hydration, overall diet and exercise becomes very important for bowel movements. And similar to peeing, you don't want to be pushing, straining, holding your breath. Again, all you need to do is sit, relax, and if those are not helpful enough, get a squatty potty to make sure that your pelvic floor is in the best position for helping comfortable pooping.
So number 4, abdominal massage for further relaxation. So the I love you massage is really good massage that promotes mobility of the abdominal wall and colon, and it also just helps you to be relaxed. This massage is also great for any constipation, bloating, pain with periods, pelvic pain, and it follows the directions of the patterns ILU, so I love you massage. So to do it, you're going to start at the top left of your abdomen, and you're going to go down towards the bottom, towards your left hip. And you just keep going down, like 10 to 15 strokes in each direction. So this is the I. So you're starting on the left side at the top rib down towards your hip. And then for the L, you're going to start on the right side. You're going to go across to the left, down towards the left, and that's in the shape of an L. And you just keep going, same thing, like 10 to 15 strokes each direction. And then the U is a half circle around the belly button. So you start on the right side and you go up and around and down towards the left. And you keep going, same again, 10 to 15 times each direction. And all of these letters are going down towards the left because that's the direction of how the colon goes, and that's the way that stool moves through our system. So we're going to be leading you guys through some stretches and a couple strengthening things, but mainly stretches. So the first one we're going to do is diaphragmatic breathing, and then we're going to do happy baby, and then we'll do cat-cow, and then we'll do butterfly stretch, and then we'll do an adductor stretch, and then we'll do a bridge, and then we'll do a core activation. Okay, so first we're going to start with diaphragmatic breathing. So I'm going to have Ezgi put one hand on her chest and one hand on her belly. Good. Now we're going to inhale, and I want her to blow into the belly and make the belly expand a little bit more than the chest. And then exhale, the belly goes down. So I still want the upper chest to move because that's how we naturally breathe, but I want the belly to be moving a little bit more. So you can also, another good cue for belly breathing is imagine like you're sniffing the roses. Yeah, there we go. Good. And then I usually have my patients do 3 sets of 10 breaths for home. And then you can do it laying down. If you also want to do it in standing or in sitting, that's also an option. This is also the breathing that you should be doing on the toilet if you're having difficulty like peeing or pooping, like if you're constipated, things like that. Next, we're going to do happy baby. So I'm going to have Ezgi, she's going to bring up both legs above her and grab onto her heels. And you can, whatever's comfortable for you, you can grab the inside of the heels, the outside, the back of the legs. It's just based on your flexibility, whatever is most comfortable for you. Yep, you can also do that. And I also cue my patients to do the diaphragmatic breathing during this as well. Good. And then we'll just hold 3 times for 30 seconds. All right. Next one we're going to do is cat-cow. So she's going onto her hands and knees. So for the cat, she's going to arch her back. And then the cow, she's going to reverse it. And the breathing for this is inhale on the look up and exhale on the look down. Yep. And then try to get as much. Yeah, there you go. Good. And so this is really good for pelvic mobility. See how the pelvis is like rocking back and forth. And then overall relaxation, and really good for breathing as well. And you can do this 3 sets of 10 too. All right, next stretch is butterfly. So this stretch is butterfly. So Ezgi is very flexible, so your butterfly might not look like this, but that's okay. Everybody's different. So this is a pelvic floor opener. As you can see, her hips are wide open, her butt is on the floor, and then we're going to be doing some deep breathing here as well. And then this one 3 times 30 seconds. Okay, so the next stretch is adductor stretch. So this is for the inner thigh muscles, and these attach all the way up to the top of the pelvis and all the way down by the knee. So these muscles are usually very tight on somebody who's having pelvic pain or pelvic floor dysfunction. So this is a really good stretch as well. So what I'm going to have Ezgi do is she's going to switch her hips from side to side. So she's gonna isolate, and then you can bend one knee to get more of a stretch. And so when you shift your hips to the left, you're stretching the right side. And then I would like her to hold for 10 seconds, each side 10 times. And then you can do the breathing with this. There's no like specific breathing from side to side, just deep breathing the whole time, promoting further relaxation. Good. Okay. Next, we're going to do bridges. Okay, so I'm going to have Ezgi do a bridge next. And I want her to lift her hips up towards the ceiling and then slowly lower back down. Yep. Good. And then back down. So this is really good for gentle pelvic floor mobility, also targeting the glutes. Good. And this is not really like intense strengthening, so this is okay to do. Other strengthening like Kegels for like pelvic pain we wouldn't want to do, but bridges is a really good option, and it gives support to the pelvis. And then I would have her do 3 sets of 10. Okay, next one, we're going to do some core activation. So the deepest layer of your core is the transverse abdominis, and this muscle is connected to the front of the pelvis, so the pubic bone. And when it's activated, it's a postural muscle. So it's always activated when we're sitting, standing, walking, and it really gives support to the low back too, the hips, everything. It's the base of our pyramid, and so if we don't have a strong enough base, then everything's gonna fall down. So what I'm gonna have Ezgi do is I'm gonna start by putting my hands on her hip bones on the inside so that I can see how she's activating. So I'm gonna go right here, and then I'm gonna cue her to put her belly button towards her spine. It's kind of hard to see her because it is a very small movement, but she is doing it. So what you're looking for is under my fingers for the muscle to tense. And if it's not tense, then another cue that I could give my patient is to imagine like you're pulling on a really tight pair of jeans. And then that usually does it. And this core activation is really good, again, to support the pelvis, support the low back, support the hips. I'm going to have her put her hands here and belly button to spine. Good. And then relax. And there's no pelvic movement during this, so you're keeping everything nice and flat on the ground. Try not to push the back into the floor. You're just pulling the belly button in. And 3 sets of 10 for this as well. And that's it.
I'm Ezgi.
And I'm Georgina, and we're both pelvic floor PTs at 30 Broad Street, so come see us if you're having any of the issues that we just talked about. But also, all of the exercises we just showed you, they're very, very general, and if they're causing you any pain or discomfort, then we strongly recommend you going to a pelvic floor PT and talking to a specialist.
Or if you're just curious, you can come in for a general screen. If you're pregnant, if you're postpartum, we have so many locations that is really accessible, so just stop by.
Okay.
Awesome.
Okay.
We live?
You're live. Oh, great.
Hi, everybody. Welcome to the stream. Hope you guys learned a lot in the video section we just had. So we've got our therapists here, Georgina and Ezgi, going to answer some questions for you guys. So the first question we had was a question based on, I guess, can males use this in their treatment? Is there anything guys can do having kind of pelvic pain? What do you guys recommend in that situation?
Yeah, so a lot of the things we went over can apply to male anatomy as well. So same with like bowel, bladder, sexual dysfunction in terms of pain. A lot of things can be similar. So a lot of these relaxation exercises, especially that abdominal massage and things like that, definitely applicable. But for more specific diagnoses, you would want to see a physical therapist that's certified in male anatomy treatment as well.
Anything to add, Georgina?
No, that was great. She
Yeah.
basically a full
Awesome.
thing. Yeah.
Yeah, and it's an important thing to note too. If you are a male coming in to be seen, there's different courses that our pelvic therapists take to specialize in pregnancy, male health, pelvic health, and other conditions that can happen in the pelvic girdle. So make sure when you're making the appointment, reach out to one of our centers and let them know about your condition. So this way we can make sure that we set you up with a therapist who's trained and qualified in whatever the injury is or the conditions you're coming in for. Next question we have up is after pregnancy, how soon should somebody wait to come in and see a pelvic floor therapist?
So usually you won't get cleared for exercise until 6 weeks after you deliver. So even if it's a C-section or a vaginal delivery, 6 weeks is the mark. So then at 6 weeks you can come in and see us, and then we'll give you some tips on what to do and how to help you.
Yeah, so even if you're not noticing specific like dysfunctions that we went over during this presentation, it is always good to come into therapy, get a nice screen, so to make sure that you're being set up in the best way possible and returning to your baseline postpartum as well.
All right. So the next question we have is someone made a comment. 80-year-old, and use, I hope I'm pronouncing this right, a pessary. I don't know if I said that right, ladies. Would PT work for me?
Yes. So the pessary supports all of the organs up in the pelvis, and what it does is it helps to contribute to preventing any like incontinence, leaking, things like that. And PT can still help you even if you have one, because it will still help to strengthen those muscles and also to learn proper bowel and bladder habits, and just learn overall health about your pelvis and your abdominal region.
Yeah.
Awesome. Another question we had come through. Somebody asked how long, once they've seen a pelvic therapist and they've got their programs, so they've got their exercises ready to go, I guess how long can someone expect to be in physical therapy for a pelvic health condition?
So for this, it just depends, which is our favorite thing to say as PTs. It really depends on how long you've had your complaints or condition for, how far out you are, if we're talking about postpartum. Other lifestyle factors really go into it, but I would say on average, definitely a few months. For simpler things, maybe 8 to 12 weeks, but treatment can go up to a year for certain diagnoses. But then you also always want to do some maintenance work, so you're always working on these issues that you've had priorly. So anything to add?
Yeah, I would
really
say
changes.
it depends on like the chronicity of your condition, but usually around like 4 to 5 months, I would say.
Cool. Another question somebody asked, someone gave birth about 2 years ago, and they still have diastasis recti. Is something that can be fixed? Can PT help? What should they do?
So diastasis, it will not go away, but we can make the core stronger and help you to manage your loads better, give you some lifestyle modifications, and help you to increase your core strength in a way that's good for you, and then also some tips on things to avoid as well.
Yeah, and it's definitely not too late because we're talking about the musculoskeletal system, and we can always train and adapt things because they respond to loading. And even though it's not going to be fixed, or if we're thinking about like physically if it's going to go away or not, we can just make sure that everything is supported and the rest of your body is also helping support your core at the same time, so you don't have any impairments that are caused by diastasis.
Awesome. All right. I don't see any more questions. Anybody has any more questions? And as always, for more specific questions that you might have relating to a specific condition or a specific injury, feel free to reach out to any of our pelvic therapists. You can call our numbers, or I'll post it up on the stream here. Feel free to reach out anytime. The reception team will be more than happy to get you set up with a therapist who can treat you for whatever it is you're coming in for. So feel free to reach out and we can get you all set up.
Yes. Thank you for watching.
Thank you, guys.